The CDC is warning about a, quote, distressing trend in the pandemic. Coronavirus cases are increasing across 75% of the country. This comes as over 8.3 million Americans have tested positive for the virus. The country is also seeing an average of more than 700 deaths per day, 700, with the total surpassing 222,000. Health and Human Services Secretary Alex Azar discussed the timeline of a coronavirus vaccine on CBS this morning. Here's what he had to say.
What we've said is that we believe, because thanks to President Trump, we're manufacturing all 6 vaccines at commercial scale right now. We believe by the end of this year, we would have enough FDA-authorized vaccine to vaccinate our most vulnerable people. By the end of January, enough vaccine for all of our seniors, as well as our healthcare workers and first responders. And by the end of March to early April, enough for all Americans.
Emergency medicine physician Dr. Uché Blackstock joins us now with more. She's a Yahoo News medical contributor and founder of Advancing Health Equity. So, doctor, an analysis of over 114,000 coronavirus-related deaths by the National Vital Statistics System found that the death rate increased over 10% among the Hispanic community in August. What are the implications of this report?
Yeah, so very troubling numbers. We saw that increase in mortality rates, specifically in August and ongoing. And we know that it's due to several different factors. The primary factor is the type of jobs that this population has, more likely to have service workers, agricultures, meat packing type jobs that put them at risk for being infected, because these are in-person jobs. Housing is another issue in that these households are often multi-generational, and people often are living in congregate settings as well. So again, a lot of risk factors that need to be addressed, hopefully in the next stimulus bill, in order to mitigate the risk of continued devastation for the Hispanic community.
And based on the same data from the CDC, people who died from COVID-19 in the U.S. predominantly shifted from the Northeast to the South and the West. What were some of the factors that contributed to that?
Well, just one thing to note is that, the virus goes to where it hasn't gone before. And so while it had hit the, by coastal cities, in New York and other cities in California early on in the pandemic, it was really only a matter of time before it would get to the rest of the country. But other factors include, reopenings in those other areas, and also, relaxing restrictions. People wearing masks less often, having a family and social gatherings have also been implicated. I think people are understandably getting pandemic fatigue, but when that happens, that leads us to more risky behavior. And so those small family gatherings have actually proven to be incredibly risky and are driving up those numbers in the West and in the Midwest currently.
The CDC is redefining what it means to be in close contact with someone who has the coronavirus. Explain this new guidance, because it's a little disconcerting.
Right. So first, I will say that knowing what we define as close contact is incredibly important in terms of who we decide to test and contact trace. Previously, close contact was defined as anyone you were within 6 feet of for 15 minutes, anyone that you exchanged eating utensils with, anyone that you kissed or hugged, or if you were involved in home care for someone who's known to be infected with coronavirus. But this new recommendation is based on a recent occurrence in a prison. Essentially, it's saying that, if someone is in contact with someone who's infectious for a cumulative amount of time of 15 minutes over 24 hours. So this is repeated contacts within 6 feet, then that's also someone that's considered a close contact. And so what happened in this prison was there was a prison guard who was infected. He wore a mask and goggles, but he had a series of brief, repeated encounters with several prisoners, and about 6 of them got sick during that time period. So that it was, in essence, a super spreader event that led the CDC to update their guidelines.
So, according to the American Academy of Pediatrics, the U.S. is seeing at least a 13% rise in COVID-19 cases among children and teens. I suppose that's not tremendously surprising. A lot of kids have gone back to school, back to the classroom, so you would expect that there would be increased exposure for children. But severe illness from the virus remains pretty rare. But I think about the holiday season when people are going to be gathering, multi-generational gatherings. This is the time that you might let down your guard. What are some of the concerns, particularly when you know that you have young kids who are going to school and, may not actually present with symptoms?
Right. And so actually what I will say is, we actually don't know whether schools have seen any spikes yet. And I think that, the increase in cases may be related, maybe partly related to schools, but it's also related just to relaxing of restrictions over the last few months and people spending more time indoors. And so I think that what we have to think about is, over the next few months, as we're spending more time indoors with the cold weather and as holidays approach, thinking about, how children can actually be vectors of this virus. And so, I think what we've seen actually from school reopening is that children will wear masks. And so that's incredibly important, just to encourage those good habits. But that, the same preventive measures that adults are using, we need our children to use as well, and really keep them informed that good hand washing, physical distancing, mask wearing are all effective, and we'll need to essentially be to hunker down with those measures over the next few months as the weather gets colder.
Doctor, let me ask you about this troubling development. A Brazilian man participating in the country's AstraZeneca vaccine trial has died. Health officials say the volunteer reportedly did not receive the vaccine. What more can you tell us?
Right. And so, these, what I will say, definitely concerning news, but this is what typically happens during a trial. And this person actually was in the control group. So this person actually received the placebo vaccine, not the actual vaccine. And so this person actually became infected and ended up dying from COVID-19. But what I think that this case exemplifies is that the importance of this safety process that is taken in clinical trials, that, that if there is a subject that becomes sick, that the study is halted briefly, and that we determine what is the reason for this and what group was the subject in. And then if everything is fine, or doesn't seem related rather to the vaccine, then the trial can continue.
Yeah, it's a reminder, though, there are all sorts of precautions being taken, that the people who are willing to put themselves in this position to hopefully allow the rest of us to get a proper working vaccine are really taking a tremendous risk, and we really owe them a debt of gratitude. And unfortunately for this individual, it didn't turn out quite very good at all. Hey, Dr. Uché Blackstock, it's always great talking to you. Thank you.
Thank you. Thank you for having me.